The term cancer used to be a threatening word that few people dare to mention. Is this disease so horrible? Half a year ago, Mr. Zhang had suffered from a little cold that coughing, chest, and lacking strength came in at the same time.
I seldom pay attention to my health before because I'm always feeling good.
Being confident of his health, Mr. Zhang thought that taking some medicine and a sleep would do him good, but surprisingly the disease lasted for half a year. He was wondering that why the disease would be so lasting. He was shocked by the diagnosis report. The moment when the cancer came, the patient would easily sink into shock, fear, and escape. Is cancer so scary? Is there any other effective treatment except the chemoradiotherapy? We use the usual way to explain it. It is to kill one's disease by his own cells. We call this autoimmune treatment. One is the DC cells and the other is the CIK cells. They can be used to improve the immunity. When the CIK cells are injected to the patient, they can detect the tumor cells and attack them. Is the autoimmune treatment so magical? In the coming Nobel ceremony, Professor Stammen, entitled the Nobel Prize owner, will give related introduction on this high-end technology.
He applied the outcome of his research, the immunity of dendritic cells on himself. After this technology is tested on him, it is widely used in global.
Like Professor Stammen, Cancer Hospital in China Medical Tourism also starts to intensively use this new technology. In this way, the patient's pain in chemoradiotherapy can be lessened dramatically and realize the vision to live with cancer.
To the patient, if he chooses the biotechnology treatment in the right time, the effect would be better than the rural one, especially on the quality of life, recurrence rate, and metastasis rate.
Through the industry's work on the research and clinic testing on the technology, Cancer Hospital in China Medical Tourism now opens different kinds of stem cell therapy toward different diseases, including the DC cells and CIK cells, allowing the patients with cancer have differentiated treatment and assessment in different stages. The outcomes are good in the malignant renal cancer, prostate cancer, lung cancer, and breast cancer so far.